Hi, I'm Rusty Bailey, your mayor in Riverside. One key to getting our community through the COVID-19 pandemic is accurate data that helps us make better decisions as decision makers for our community. Let's take a look at the numbers with our local experts.
Hi, once again. Welcome to another segment of Riverside Monthly with Mayor Bailey. My name is Steve Brazel, and I am joined again for this segment, as you would guess, by the mayor for the city of Riverside. Mayor Bailey, how are you?
You know, I'm ready to go. And we got some important people, some VIPs with us today, some very important people with us during this COVID-19 pandemic.
And an important topic, we're going to be addressing the COVID-19 numbers here in the city of Riverside. We're joined by two guests this time around. Emergency Services Administrator for the city of Riverside, Mark Annis. Mark, how are you?
I'm doing very well, thank you.
Also from the Riverside Fire Department, their Public Information Officer, Brian Guzetta. Brian, welcome.
Welcome. Good morning.
Like I said, they're VIPs and they run the EOC, otherwise known as the Emergency Operations Center, and they've been keeping their eyes on the ball for the entire pandemic and have been doing an incredible job, 24/7 operations. And so I'm just really proud of the effort that they put in during this very difficult time for our city. And so explain to us how emergency services gets their data and how it's used. Data has been very important for us in terms of decision making. We shouldn't be making decisions for the public with lives on the line without the information, without the data. And so tell us how emergency services gets their data and how it's used.
Yeah, Mayor, like you said, there's a lot of data out there. There's a lot of people that are reacting in various forms during this period of time. And so for us here at the EOC, we try to gather data so that we can compile it so that our leaders can use that data to make decisions. So we start with trying to find the best data there is. And fortunately for us, the state is, for the most part, the keeper of the data. We work with our state partners, our county partners to utilize the same data so it's consistent across the board. So we get our data mostly from the state and the county level, but we also reach out to our local hospitals to get updated data when it comes to hospitalizations and ICUs. Ultimately, we were just trying to paint the best picture we can, decipher data, collect data, look not only at today's data, but the trends of this last week and the last month to get that information, compile it together, and then make it readable and usable, not only for our city leadership, but also our public, so that they can get a good understanding of exactly what is the state of COVID in our city, in our county, and in our state, so we can drive and at least have a mechanism to make some data-driven decisions.
Yes.
A tool, as it is, for our leaders to use.
Yeah, and I am curious is a good way to word it. We've got all of this data. It's being utilized, but how is it being actually distributed? Because having the data in a silo obviously doesn't help. Different departments, different utilization purposes of that data. How are you getting that data distributed?
So we've been distributing what's called a situation summary to our internal partners for 112 situation summaries, so 112 days. We do a daily report, and it goes to all the departments. It goes to city leadership to understand what's going on in the city. We also share with them the county situation summary, and then working with the Joint Information Center here at the EOC, the public information officers for the city get together and take that information to allow themselves to distribute that out publicly. So working through that information, they can put out public service announcements, put out social media campaigns, posters, and then figure out if there's places that need to be targeted with information due to a hotspot activity and so forth.
Yeah, one example of that was grocery stores, right? There was a lot of in businesses in terms of masking up. The city took an extra step to ensure that businesses were posting the mask up signs and that information was getting out. You want to follow up on that, Mark? Any specific hotspots that are out there or that we have kind of pushed more information to than others?
The way we get the data back from the county is by zip code. And 92503, currently it has the most total cases from the very beginning, but also continues to have the most number of cases on a daily basis, almost daily basis for our city. And so we're able to work through that and target that particular zip code, whether it be social media, being able to pay for additional ads. So basically targeted. So boosting your social media post in that particular zip code. And so that's one way. Boosting outreach, working with the various departments to help in that area for education. So we can utilize different departments, including the police department, to help educate if there's additional businesses that need to be outreached to help them to understand the various regulations and rules.
Exactly. And what are the trend lines for the city of Riverside? You mentioned trends. Trends are very important for us to be able to look at information over a period of, like you said, a week or the whole 112 days of the pandemic. What are the trend lines that we're seeing?
Yes, Mayor, and that's so key, is that this entire time we've been digging through this data, looking at exactly what's occurring, and trends are the key, because we know that there can be fluctuation day to day, but we're looking at the trends for a weekly basis, a monthly basis. We're trying to compare where we were at in July now to where we were in April and May and June, to kind of get an idea. Were the decisions we made in those months, how would they correlate to the decisions that we have now? I think all of us know by reading the news and just day to day, July is going to be our worst month yet. Our numbers are going to far exceed every month that we've had prior. Our hospitalizations, our test positivity, the cases in the county and the cases here in the city, they're all going up. So we're tracking that daily. July is going to be our worst month. We're going to see if those trends continue, or if some of the diligent efforts by our residents, by some of the directions that the state has given out, by our wear a mask order, by our social distance order, if we can see if we're going to get some results in those. So we're going to really keep an eye moving forward on that data to hopefully put a cap on July.
With those trends in mind, I'm curious, how are the trends for the city of Riverside comparing with county as a whole, for the county of Riverside, or for that matter, the state as a whole?
So county as a whole, we are slightly lower than how the county is rising. But with that's in the number of cases. Hospitalization, utilization, people that are utilizing the hospitals, we are much higher than the county as a whole. But also, as a state, we're rising at a higher rate than the state is. So the past few days, the state's been rising at 1.4 to 2%. We're rising at 2.5 to 2.9%.
And we try to look and provide not only our county, but we look at like cities, like populations up and down the state, to really get a barometer of where are we? Are we alike with some of these? Are we in the exception? Where do we stand? Just to give as much information as we can to our leadership to make that decision, to get a good idea of where the city of Riverside is currently, today, and in the past.
Yeah, and you mentioned that July is seeing some new record numbers. What does the most current data say about the need to wear masks, to wash hands, and to maintain physical distancing?
Well, as we've been saying all along, the basics are really what counts. And the basics can truly mitigate the effects of the virus until we have a vaccine or a treatment plan. But I saw just this week, it was yesterday, in fact, that an article, a study was published in PLOS Medicine, PLOS Medicine Journal, which is an open access journal, so not a subscription based, so anybody can read it. And it basically said that if you did those three things, you would stop the pandemic. You'd have small outbreaks, but you would stop the pandemic.
So my question is, people, after all of these numbers and all of this data, they're going to want more information. Where can people go for that?
So we're real fortunate, a robust communications team that is streaming this or daily on all of our social media platforms. that all those link back to riversideca.gov/COVID-19. We, as the EOC, publish a matrix of where we stand on a daily basis. All of our city social media platforms are working daily to inform all of the public on every trend, whether it's closures, openings, the status of our city, the status of case counts. We're just trying to keep our residents as informed as possible, especially during these troubled times. Information is key, but more importantly, accurate, timely information is the key. And I think that's the goal of us here at the EOC, is that we can provide that on a daily basis, accurate, timely information on this crisis.
And as they said at the EOC, we can make a difference. We can make a difference in this pandemic, and we can flatten the curve by wearing masks, washing hands, and maintaining physical distance. Everybody can make a difference.
Yeah, and things can still get done. We're doing this show thanks to the people at the City of Riverside TV for putting this together so that we can even do things like Riverside Monthly remotely. So again, I want to thank our guest this time around, Mark Annis. He's the Emergency Services Administrator for the City of Riverside. Mark, thank you so much for joining us.
Thank you for having me.
Also, Brian Guzetta, Riverside Fire Department PIO. Thanks as well for joining us.
My pleasure.
And we
And
can get more
Mr. Mayor,
information. Yeah, of
great
course.
to see you.
311, if anybody has questions about this or anything else, 311, one call does it all. But did we give them the website for COVID?
Yes, it's riversideca.gov/COVID-19.
There it is.
So head on by there.
Great
get
information
the information that you need. And again, if you need to even watch this segment again, if you want those numbers, but the main thing is mask up, wash your hands, and maintain social distancing. This is Riverside Monthly. I'm Steve Brazel. Thanks for joining us.